to tell me, from molecular medicine to becoming a global leader, what is the journey? Where did you start? Where?
When IVF fails, when IUI fails, then there is an option of the either surrogacy or the donor egg or adopt. But someone wants their own biological child. What should be some alternative? If we can regenerate human being, if we can enhance some organ capacity. So this is what drives me to put my effort more into the research. Regenerative medicine is the future for Menarche to menopause.
Yeah. People are talking about living up to 120.
बाबू मुसाए उम्र लंबी नहीं होनी चाहिए, उम्र
Quality वाली होनी
quality
चाहिए.
of the life.
Healthy,
So-
wealthy भी होना चाहिए. We were talking of stem cell. Now we are doing stem cells.
We are far ahead in our country.
Is it only for the rich people?
It's costly because the kits is around 9.5 lakh rupees they are selling.
Really?
Our government is promoting like Make in India, and give me a decade. My dream is to bring the stem cell therapy at 5 to 10,000 rupees.
India needs more and more innovativeness, and because all our brain goes away to US or UK.
No, we believe travel all across the globe, but serve for our own
Serve
country.
for your own country. Welcome to the Science of Beauty and Wellness by Dr. Anjali Hooda, where real stories meet with real science, and health is not limited to diet charts and creams. Being an internal medicine doctor and then going into functional medicine later, I realized that being holistic and giving a holistic approach to the body and to healing is the most important way to look at health in the future. In this series, we sit down with bold voices, the change makers, from pilots to actors, fitness leaders to wellness pioneers, with their inspiring stories on health and wellness and discipline. This is your space to learn, reflect, and glow from inside out. Welcome to another episode of Science, Beauty and Wellness. And today with me, the guest is Dr. Prabhu Mishra. He is a very well-known entity in the world of stem cell. And I would like to tell the viewers that both of us are wearing colored glasses for a reason, because we have really recently discovered that wearing colored glasses reduces the eye strain. So I have my color, he has his color. So before you judge us doctors, so let me put that very clear. Dr. Prabhu is the president of IASRM, which is International Association of Stem Cell and Regenerative Medicine. He's a global leader in regenerative medicine. He's a forefront of stem cells, longevity, anti-aging revolution. And get ready, because today's conversation is going to be all about longevity and looking young and feeling young in many aspects, cellular and by the way you see us. All right, Dr. Mishra, most welcome.
Thank you. Thank you so much, Dr. Anjali, for inviting me on this wonderful platform where you are already creating such a great awareness, not only to the medical fraternity, but to the society and the mass level, where the real education and awareness are needed about this longevity, anti-aging medicine, and the regenerative medicine.
Absolutely, Dr. Prabhu. I'm so happy to have you here because regenerative medicine is the future. Watch till the end. I'm going to be talking about the regenerative aspects of menopause management, the ovarian rejuvenation, and fertility. You want to get pregnant, you want to watch till the end. So, what drew you to regenerative medicine?
See, regenerative medicine, as its name says, whenever we talk about this regenerative medicine, most of the time I always say, there was a need of separate era or not. Because in medical science, we debate about there is a transfusion medicine, there is a hematology where we do the
very
PRP,
compartmentalized. It has become, yeah.
So why? People think regenerative medicine means only stem cells. A stem cell is one of the pillar of the house. Because we are talking about the house, it's rooms, it's everything, fabrication. So similarly, regenerative medicine is based on the principle of regeneration. For regeneration, we need a complete cargo. Stem cells.
Right.
Then we need some vesicles like exosomes, like nanoparticles. Then tissue engineered, those which are connecting the dots, like non-healing ulcer is someone having diabetic foot. In that case, we need something to connect. That's a cellular matrix. That's a tissue engineered products. Tissue engineering is there. Then another thing, some disease like gene-related disorders, like muscular dystrophy or the autism. or the motor neuronal disease like amyotrophic lateral sclerosis.
Yeah.
These all are the gene-related disorders. Dystrophin gene in muscular
Yeah.
dystrophy or superoxide
Yeah,
dysmorphia.
yeah. I just had a patient of muscular
Yes.
dystrophy.
So
Yeah.
this kind of indication where we need the gene modification. So another area is the gene therapy or the genome editing tools. And then these days many energy-based devices, medical devices, which are bringing functional changes, and the molecular medicines, epigenetics. So these all combining making a separate branch of the medicine called the regenerative medicine.
To tell me, from molecular medicine to becoming a global leader, what is the journey? Where did you start? Where?
So, being a basic researcher, basic science researcher, it was always a challenging to work with the clinicians. It's a
Right.
very much big challenge. But we always believe when we started in 2004-5 about the stem cell research, it was so primitive in that days, globally, not only in our country, it was very primitive. No doubt there was top scientists like Senyaya, Manaka, and all are working in the day and night. But it always inspires when you see the some degenerative conditions surrounds you. Like many, definitely the apart from the oncology, like multiple sclerosis or psoriasis, systemic lupus erythematosus, SLE, or any degenerative conditions, type 1 diabetes. Let's say talk about the liver cirrhosis
Yeah,
or the renal failure like chronic kidney disease. So this always makes me like, what should be some alternative if we can regenerate human being, if we can enhance some organ capacity. So this is what drives me to put my effort more into the research. And I globally traveled and got the training from the premier institutions everywhere, somewhere online, somewhere physical, including the University of California to the Pittsburgh to the UK, everywhere. Then
Yeah.
Pasteur Institute online courses of the stem cells, many and then the like I did even recently I did, because in our time it was a biotechnology.
Yeah.
In recent era I did in 2019 MSc 2-year course from Amity, like molecular medicine and the stem cell technologies to what latest in the world. So it's not like that. Stem cells, we are far ahead in our country.
We are?
Yes.
Really? Yeah, because I also getting into the regenerative medicine, but mainly through peptides right now. But my whole idea is to obviously train with you and learn about more techniques how we can do regenerative medicine. So, can you share me one breakthrough that has shaped your career?
Especially when I started doing the work, I started with the osteochondral desiccants, full thickness articular cartilage damage in 2019. I did with all top leaders of our country in orthopedic and sports injuries, in Dr. P.K. Dabe to many great renowned names. We worked with full thickness articular cartilage damages. But I have shifted my interest in 2007 when Chang paper came about the thin endometrium rejuvenations, and I started doing the basic work about the ovarian rejuvenations and the menopause management and the endometrial regenerations. When we started the platelet rich plasma with various gynecologists, we collaborated and started doing the basic work, and we
Right.
saw the great vascularity is achieving, especially because sometimes you think like, oh, our country is having such a great population, then why we need the baby again. But those who are suffering from the fertility, it's a
Yeah,
big
yeah,
challenge for that family.
Yeah.
When IVF fails, when IUI fails, when then there is an option of the either surrogacy or the donor egg or adopt. But someone want their own biological child. If the conditions is like endometrial conditions, thin endometrium, and lining is not improving, ovary, like they are getting menopause in their 30s.
Yeah,
They are
yeah. I see
arresting
a
their
lot
cycles.
of young.
And these days the lifestyle
Yeah.
was the big challenge. Then even in the male part, not only the female part is always culprit, in the male part like oligospermia, sperm motility is very poor.
Yes.
Like very count is very less, or either the nil sperm count, azoospermia. No doubt in male infertility, stem cells are very poor role right now. It's on a part of the basic research, but especially in endometrium or POI, primary ovarian insufficiency, this PRP or the bone marrow autologous stem cells have shown some efficacy at the initial cases. So this is how it drives me. And nowadays we are having a full-fledged team, and we are working for much more the debilitating conditions from the endometriosis.
That's a very debilitating
Yes,
condition,
so
right?
endometriosis, multiple sclerosis. So this kind of conditions are driving me for the more and more dive into the research.
No, I've seen like we have so many young patients with infertility. They're in their 30s and they've had a premature ovarian failure. Very, very common. And endometriosis is very common. Very
Yeah, it's a very
common.
painful conditions,
Yeah, it is very
especially.
painful. Yeah, and I see there are a couple celebrities also who have talked about endometriosis. There are a couple,
Yep.
and they spoke very openly about it, but still awareness is very less.
Yep. We always call regenerative medicine is the future for menarche to menopause. Like it start from the young women, starting from the PCOS, PCOD management,
Yeah.
it goes towards the menopause. So that's why we always call like regenerative medicine is the future for menarche to menopause.
Longevity revolution. People are talking about living up to 120.
First of all, I'll tell you like what not to believe. I don't believe in the number 120. But the thing is, 120, why it's quoted? Because our DNA lifespan is 122 years. And definitely it can be achieved. So definitely health span versus the lifespan. And where it comes about the longevity, like you are already an expert about you are doing the BHRT, peptides, nutraceutical IV, and the holistic approach.
Yeah.
Definitely regenerative medicine is one of the pillar for the self-renewing or the detoxification
Right.
part. Definitely it can be achieved. The goal is here what should be the great health span versus the lifespan.
Right.
So that's why I always say like Babu Musai, umr lambi nahi honi chahiye, umr अच्छी
क्वालिटी वाली होनी
quality
चाहिए
of the
ना,
life.
हेल्दी
So-
वेल्दी भी होना चाहिए. पता लगा कि गरीबी में लंबा जी लिए तो क्या होगा. I feel wealthy is also as
Definitely.
important. So tell me, exosomes are being called as the next Botox. Do they have that potential?
I'll tell you. Last week I was in Cambridge conference, Cambridge University. I've invited at King's College.
Yeah.
So, and the first battle for 90 minutes, and I was one of the panelists, they called it gladiator there.
Yeah.
So I was the one of the gladiator in that first panel of the battle, exosome versus secretomes. So it was a very interesting thing. Exosomes these days, sometime I called even we have concluded right now the way exosomes is named for most of the products, it should be the little bit corrections and more rigorous research are needed.
Yeah.
We don't know how this is going to affect after 10 years.
Yeah.
There is no
I think it's a lightly used.
yes, only in aesthetics currently used. Topical usage is permissible.
Yeah, yeah.
Most of it, not we cannot say like it's permissible, but some of the products which are rigorously used.
Yeah, yeah.
I should not take any brand name because there is nothing. It's,
No
this is
association, yeah.
no association right now. But if we'll talk about the exosomes, exo means external. It's the vesicles. It's a autologous still fine. It's like a photothermal biostimulation of the plasma or the proteins or the peptides. You can split into the nanoparticles, and their penetration capacity will increase, and it will work much more better than the PRP, platelet-rich plasma. But exosomes is one of the intermediary of the secretomes. Secretomes will be much more superior than the exosomes, and probably in the future, like especially in the oncology, there are various things are used like NK cells to the dendritic cell vaccines. Then T regulatory cells, and then the secretomes. Secretomes, it's from the mesenchymal stem cells, even from the and mesenchymal stem cells from the adipose,
And the fat tissue.
from the fat tissue. So fat to the these are like most waste of the body is the fat, and they are giving you the most viable potential biologics for the self-renewing and regeneration. So exosomes, definitely it's a future. Definitely it has the potential, but it should be controlled. Where to use, where not to use. And as a clinician, you should know, and as a scientist and researcher, we should know the inclusion and exclusion criteria of this.
Stem cell therapy for fertility and menopause. How far have we come?
In our country, like I am running my training program for fellowship program for regenerative medicine, trained more than 2,000 gynecologists. And most of them are practicing the regenerative medicine, especially PRP or autologous BMAC therapy, subendometrial injections in Esserman syndrome or the thin endometrium or the laparoscopic or transvaginal, the bone marrow or the PRP into the ovarian cortex for ovarian rejuvenation or follicular genesis. And there are many of the success story. It's not like nothing is 100% in this world, especially in science. But if you see the result, it's around 18 to 35% is the results.
Okay.
Because we cannot say there is nothing much more controlled RCT is there in our country, not a big studies.
Yeah.
But the thing is, on the basis of initial experience of last 10, 15 years, definitely it's giving the results.
Yeah, we'll talk about it in the end about the fertility that can, that can be enhanced with the help of
Even
stem cells.
orthopedic usage are there,
Oh
sports
yes,
injuries,
yeah, yeah.
osteoarthritis, say vascular
I think
necrosis.
eventually the surgical options for bones like joints is going to fade away. I think
Yeah, like
a lot of it
it
will
will be
fade
an
away.
alternative, especially those
Yeah,
who are hypertensive, diabetic, obese, those who don't want the TKR,
yeah,
especially
yeah.
for those group, it will supplement and
And it has to
somehow,
be done earlier, right?
yes,
Even if it's a
as a
yeah,
preventive,
yeah,
if
yeah,
you'll talk like OA grade 1 or 2,
yeah,
this kind of it
yeah.
can work like a preventive medicine.
Biohacking and celebrity culture. Is India ready for this wellness trend?
See, this is a very, very nice and amazing question, Dr. Anjali. And as you are already a longevity expert,
Yeah.
these all like biohacking, longevity, anti-aging, and these days another new terminology we heard, gerotherapeutics. It comes from the like geriatry, so
Yeah.
gerotherapeutics. So biohacking is ultimately what? It's a holistic approach, 360-degree approach
Yeah.
of the management. Definitely the technology assisted and as well as the combination of holistic approach. So definitely the biohacking, and most important part of the biohacking, I always believe what people can do themselves. So because there is always a assistance, but what they can do, self motivation is the key important
Yeah,
for
that's the
any.
number one biohack
Yes,
actually. Yeah.
one of the biohack we consider the self motivation, because if they want exercise, if they will not do, if they will not eat at a correct
Yeah, if you
pattern.
don't change your lifestyle, what is
So,
biohacking going to
so
do?
that's how. So I always believe for any biohack, the primary thing is the self determination, discipline, and the devotion towards
That's a
yourself.
fantastic things to say. I mean, I think that is one of the golden line of this video
Yes,
is going to be
I,
about this. Self motivation is
self
very,
motivation. I always say like pamper yourself in a disciplined way.
very good. Very nice. Yeah, you don't have to like cut off from everything and stop this,
Yeah.
stop that, but you can just
Pamper yourself means don't taking
ration it.
don't booze with alcohol and smoke. Pampering, have the self motivation and the discipline.
Yes. So I'm going to ask you one important question. Where do you see the overlap between functional medicine and regenerative medicine?
It's a complementing each other. It's like one of the pillar. We say like it's a trio kind of like. It's like in Mexico we say if trio is there, there is a harmony among all three. So this is one of the like harmony to, if we want to have the best results, functional medicine is the key important part. And as the name says, functional medicine, it bringing the changes into the functionality. That means they are bringing the biophysical changes.
Yeah.
So it's always a complementing and one of the trio.
Yeah, that's a very well said thing. Do you think that regenerative therapies will become mainstream someday?
In near future, definitely, but still, as per current scenario across the world,
Legal regulations
the
are.
regulatory framework, regulatory vacuum, research, clinical, academia, and industry coordination required across the globe. Like researcher cannot go in one path, industry cannot develop in one path, and clinician.
Yeah.
It should be the sync. There is a like a synchrology and like unanimous and anonymous kind of things is required, where the research to the like bench side to the bedside, or the I call it pill to like cells to pills.
No,
So
I think also, Dr. Prabhu, the primary care physician has to understand and embrace this change.
definitely.
You know, a lot of times the primary care physician is not embracing a lot of changes. Like I get a lot of my bioidentical hormone patients saying, oh, my gynae said not to take it. You know, we all have to come together with to advance this, a patient outcome
Very true.
by embracing the new changes that we are experiencing in like the world of regenerative medicine or the world of functional medicine, for example. And there is, as I said, a lot of compartmentalization of different specialties. So nobody's actually looking at the patient as a whole.
See, if we'll talk about nowadays the adaptability, even in our country, like talking from the premier institution like All India Institute of Medical Science, they are having wonderful stem cell department led by Dr. Sujata Mohanty and many other Dr. Silpa and all. They are doing amazing work, not only into the gynecology, starting from the all top to bottom. If you'll see the work into the liver cirrhosis or the liver regenerations, especially by Dr. Silpa Sharma, or in Gangaram Hospital by Dr.
Yeah.
Anil Arora, they all are doing wonderful work, especially. And this kind of conditions, like someone having the NASH, like fatty
Yeah,
liver to NASH, like early fibrotic cases to the cirrhotic cases, no doubt, without the honeycomb structure. In that case, definitely these kind of things are like one of the key pillar. Like everyone cannot go for transplant, everyone cannot afford as a revenue wise, everyone
Yeah, it
cannot get
becomes
the
very
donor.
expensive. Yeah.
So then there is definitely a option there. So it's a supplementing not only for the cost efficacious, because it have shown in initial research, especially in liver, in case of cardiomyopathy. If we'll talk about the myocardial infarction or ischemic cardiomyopathy, world top leaders have tried even in, and if you'll see the clinical trial studies, it have shown the initial satisfactory results. Even in initial study of the Dr. Sandhu in our RNR hospital, Army Research and Referral, we found some paper. It's a very good paper. Even in CMC Ludhiana, we did few cases of very initial stage of my career by Dr. H.S. Bedi, sir, in critical limb ischemia and all. So it has shown the initial results is mesmerizing. So it's like a multidisciplinary approach. And this is definitely going to change, or the paradigm shift will be in the healthcare in coming one decade.
Yeah, I think I've seen in one decade, since I've been back to India, I've seen that we were talking of stem cell. Now we are doing stem cell. Like it has become only one decade. We have seen so much change. Now
Progress,
exosome
yeah.
word is everywhere.
It's a progressing,
Even if
yeah.
it's yeah,
Three,
even
4
if
year
it's
back,
yeah.
like exosomes, we are
Nobody
just
knew
knowing.
exosome.
Yes, we were just in the part of the research we were doing because we are in hardcore of stem cell research.
Yeah.
But now every packaging, like 100 of vials are available in.
Yeah. When I was working with Fountain Life, I remember they were doing exosomes in US, and I came to India and nobody knew the word exosome. I'm talking 2021. Like nobody, not the regular people. I'm not saying you, but I'm saying regular. Now exosome is everywhere. You go to any clinic, especially aesthetic clinic, they are pushing exosome here. They are pushing exosome here.
I'll tell you one thing, very peculiar things. Like I have conducted my training program in Mexico in 2021 January. I have been there to Dr. Ana Hernandez. So when we went, like they are doing the Patanjali derived, this cord tissue derived allogenic mesenchymal stem cells vials. They are having 100 million, and the exosomes vial. And I was also having the fatty liver. In India, almost most of them we are having the grade 1 fatty liver.
Yeah.
And my OTPT was continuously like 55, 60. It was this kind of range for quite few months. I tried mesenchymal stem cells IV.
Acha.
Yeah, 100 million. And the exosomes 5 ml vial, 5 billion cells. And it's for 5 years now, everything is normal. And one thing I'm feeling, I never feel fatigue.
Oh.
I never feel fatigue. My all blood parameters are amazing.
I also need it.
It's amazing products in Mexico. We have seen like they are doing
Mexico
this
is a hub of all
hub,
this.
like especially a few of them, like their research team. Even my one of my gynecologist, Dr. Martha, she is doing innovative work. Like she is doing the oral mucosa fibroblast or the vaginal mucosa fibroblast. They culture it for 4 days, and then they inject for the vaginal atrophy, GSM, vaginal rejuvenations, stress
Acha.
urinary incontinence, just to a 5 mm of the mucosa. She is pricking it with the needle, sending for the culture. 4 days again, calling the patients and injecting the fibroblast. Natural, autologous, cultured, concentrated products, restoration of the cells.
Perfect. This sounds so good, no? Tell me one thing. What is stem cell research? Is it only for the rich people?
This is what I always say. Stem cell is not only for the, like, it's for the masses,
It should be for the masses, right?
Ideally, if you'll see the autologous, it's the preparation costs start from around 15,000-20,000 rupees. It's not like that. Definitely, the BMT, there is certain things which are costly, like T cell repletions for hematology. It's costly because the kits is around 9.5 lakh rupees they are selling. So that will be the costly. But if we are preparing the autologous bone marrow derived aspirated concentrate or the lipoaspirate nanofactor as we have, it's under the budget. It's nothing. It's only for the rich people. It's for everyone. And this is my dream. I always say, like give me a decade. My dream is to bring the stem cell therapy at 5 to 10,000 rupees.
No, let's make it a mass thing. I'm not kidding.
Yes.
Because see, India has a very large middle class population. And to afford these therapies, it just sounds like only if you have money you will do it, because You see now the GST and all has
Definitely.
become so much fairer. Did you see that?
Definitely.
So now that should also, these like the medication cost has come down in this new whatever Sitaram ma'am has announced.
You know, our Prime Minister Sri Narendra Modi ji is so visionary person. If you'll see his visit, he visited Shinya Yamanaka Nobel laureate in stem cells
Huh.
3-4 years to his research to his facility in Japan. Apart from that, he talked many times in parliamentary sessions about stem cells and regenerative medicine 3-4 years back. There is a video on YouTube, as well as when he was the CM. They have started an exclusive center of excellence in Surat Civil Hospital for sickle cell anemia about the stem cells
Wow.
when he was the chief minister. Even I was the one of the executive director in GeoStar, one of the US based company in Ahmedabad in 2012, inaugurated by our prime minister. That time he was the CM, exclusive for stem cell therapy and research. So this is like one of the like our government is promoting like make in India, and it's my dream like to bring stem cell therapy at 5 to 10,000 rupees for masses.
Perfect. I hope that dream comes true very soon, because India needs more and more innovativeness, and because all our brain goes away to US or UK, we should be like,
No, we believe travel all across the globe, but serve for our own
serve for
country.
your own country. I
And
agree with you.
Janni Jan Bhumischa Swargadap Gadiyasi. So this is like the motherland is the heaven for us. So that's
Very good. मुझे भी आना चाहिए ऐसी एक दो लाइन, पर नहीं आती मुझे. अच्छा, what is the most rewarding case in your practice?
See, I always assist the gynecologist. So basically, I told you like my most rewarding case, like when someone is not having the baby, and once we put the stem cells and they got the pregnant. So this is the happy moment. Like one of the moment I still remember, Dr. Neeti Bansal in Phoenix Hospital. She said, "Sir, my patient got pregnant when we did the stem cells," and this is the kind of achievement.
That is
Or
a reward.
a reward. Like in Jordan, Dr. Hisan Nehmat, and many of our students when they text, "Sir, we tried stem cells." Even recently, Swagata Besi in Assam, she tried my protocol in her patients, and she texted me, "Sir, our patient got pregnant." So this is the kind of moment like what I studied. It's really in the application.
So tell me one thing: can an older woman dream of pregnancy?
See, there is a guidelines. Like we should don't go beyond guidelines. Like we
What
like
are
you
the
know.
guidelines for
Like,
older moms?
Like as well, like 45 is so 45, 46, 47 should be the ideal cutoff, and no doubt these days late marriages are there.
That's what I was saying,
Yeah, they can go
because-
for the initial stage of the life oocyte preservation. They
Yeah,
can
because one thing
ideally-
that stops a woman, I mean, or forces a woman to get married soon is because, her time is the clicking, time clock, whatever you call. But if it's possible for an older woman to get pregnant.
Up to 47 we have taken in few cases, but beyond that we should not promote, because in this generation especially now science have taken, so IVF is so advanced, they can go for the egg preservation, they can
Yeah.
keep them.
Yes,
Even they are
yes.
marrying the
Yeah,
late.
that many
But
people are freezing
especially
the eggs.
those egg freezing, especially those but 20 years back, 15 years back, those who have not done 45, 47 is the ideal
Yeah, but
cutoff.
a lot of people didn't know about egg freezing, and then they realize it's much later.
We should talk
than-
much more about that. Those, especially young lady, working professionals, enterprising, ambitious, we should educate them about the egg freezing.
Egg freezing is a very tedious thing. As per for a couple of my friends did it, and they said, "Oh, it's very tedious. You have to get so many
Yeah,
shots,
stimulations and all.
yeah, you have to get those injections and all." But then, at least that's an option. But if somebody forgot to freeze their eggs,
Definitely,
or
up to
didn't know about
47
it.
we can consider 45 age group, 47, but definitely it works under like 30 to 40 age group. Below 40, as per like Bologna criteria, if you'll see the FL of the POI or the poor ovarian reserve, consider like a 40. But we in a state, because in 40 it's okay, but the thing is sometimes people are coming to you 45, 46,
Yeah.
47.
Yeah.
So depends on the various criteria. The gynecologists see the scans, like what's the scan tells about any follicles are there or not.
I
What's
got
the-
follicles. I'm 52.
Oh.
But I don't want to get pregnant. But I had follicles in my, I think because of the kind of lifestyle I live,
Yeah.
like work out and eat well. So follicles
Exercise
are-
is very important. Exercise and the healthy food. And I always say, like, avoid the sugar, smoking. These two kills.
these two kills, no?
In
Are
our
we
country-
getting amniotic fluid exosomes?
Amniotic fluid exosomes can be prepared, and anyways, even in,
Legal?
Legit, there is currently the regulatory vacuum. It's a regulatory vacuum. There is as per current scenario, if you'll see the 2018 draft parliamentary gadget in our country, autologous, minimally manipulated is the out of the purview. Rest is the part of the clinical trial or the research.
Research, yeah, like you
Research.
have to get
But
the
amniotic fluid
approvals.
autologous can, it's preliminary. Like if you are doing the C-section, do the incision before rupturing the amniotic membrane, take 20-30 cc, centrifuge, and you can use for the same patients for stria, stretch marks, or the alongside the
Oh, very interesting.
so this is one of the
So
amazing
all
work
these
people are
pregnant
doing.
women who are going to go through surgery, make sure that you preserve your amniotic fluid
Or even not preservation during the same
during the surgery. Yeah.
C-sections only before rupturing the amniotic membrane. Meanwhile, gynecologist will take the baby out. Their technician will centrifuge it, prepare the concentrate, and inject all along the stria stretch mark incision and
Yeah.
the stria stretch marks.
Wow. So the stretch marks will not happen.
So not happen, and those which are
हमारे time में
existing, it
क्यों
will
नहीं था
go
ये?
70-80%. So
It wasn't.
this kind of science advancement came. Amniotic
Yeah.
membrane, there are various products are
Oh, yeah,
available.
yeah.
Amniotic
I've
membrane.
received one
Yeah.
amniotic fluid exosome in my foot.
Yeah.
Of course, out of India, but it was quite good.
Amniotic membrane just remove to chorion because chorion carry the
Yeah.
antigenicity. Amnion doesn't. So just do the gamma radiation or etc. So like that can be used like a reconstructive flap, like a collagen. Like people are using for hymenoplasty, vaginoplasty. One of the key opinion doctors in aesthetic gynecology from Egypt, Dr. Amr Sifeldin, he is doing amazing work with the amniotic membrane for vaginoplasty.
Really?
And many people are using like in reconstructive surgery as a regenerative flap. Even we can use in case of inguinal hernia in our country. In one of the doctor,
Oh, very common
Yes.
hernia is inguinal
So
hernia.
in case of that mesh, instead of mesh, they can use like amniotic membrane. They are having amazing tensile strength.
Yeah, even for dressing, I think wound.
Yes, wound healing, wound dressing,
yeah.
cellular matrix.
Yeah, it's called Placitrex or something like that. No,
No, the placentrex is the
Placentrex.
placenta.
That's a placenta. That's not amniotic.
Epigraph is amniotic membrane. Epigraph.
Right. I remember they have a big lab in Morristown in New Jersey where they
And
are making.
placentrex is it's a product now. It's for the better healing.
Yeah,
and
better
all.
healing Placentrex. That's been there, I think, for
Yeah,
a
it's
while.
for the David Albert having it's for last 10 years.
Which conditions can truly benefit from stem cell therapy today?
Wherever you can reach on the target. I always say like any wound.
That's a good one.
Any wound, aesthetics uses, aesthetic usage, especially for the facial aesthetics like fine line, front lines, even the hyperpigmentation.
Yeah.
Hyperpigmentation, and then like fertility we do, or like orthopedic indication, sports injury, tennis elbow, rotator cuff, plantar fasciitis, pain management. People are using these days epidural and all. So pain management is another options.
And what about neurological conditions?
Neurodegenerative and neurological condition needs a lot of research because
Parkinson's?
there is, few research have shown. Even AIMS Delhi have published about a stroke fear back. Many doctors, even in PGI Chandigarh and all, are working on this. But neurodegenerative conditions have not shown much more till now across the globe. Even if we are talking about Alzheimer, Parkinson, or any MND like SMA and ALS, etc. Because the route of administration, even the spinal cord injury, if we'll talk, this is the debate since the Superman Christopher Reeve got the spinal cord in 1999 to till now. It's a big debate, and still a spinal cord injury. Many doctors in our country have tried about this. It's like sometimes like it's we can say it's a fluke or what, we don't know, but the thing is sometimes bladder bobble control it comes, but in most of the time it's not, and it's due to of the how much early they are coming.
Yeah.
It's and it also depends
early manifestation of disease they have to come.
So these all things are there in neurological conditions. Yes, in case of multiple sclerosis, some doctor in our country like Dr. Rahul Bhargava, they have used the HEMAT protocol in that, and it's worked very well, especially in multiple sclerosis, but in early cases.
Yeah, because I did see a patient in US. That patient got shoulder stem cell therapy, and the Parkinson's became better.
Yep.
Like
I
it
told you.
was just so.
Many people are working these days on the iPSC, induced pluripotent stem cells, which have led to Nobel Prize to Sinaya Manaka and Sir Jordan in 2012. Probably this is going to revolutionize in coming one decade for various indications, not only for the neurodegenerative, for age-related macular degenerations and all.
I know macular degeneration has no other cure, to be honest, right? Except maybe a regenerative therapy. What should patients check before choosing a clinic or doctor for regenerative therapy?
Definitely the qualified physicians is the definitely one of the big thing, and apart from that, that lab should be supported by the scientist or not, because scientist is one of the critical factor. It's like IVF and the embryology relationship. Similarly, it's a clinician and the scientist relationship.
Got it.
Because preparing the cells, what cell source, what exactly the cell dosage, these all things really key matters. And definitely they should ask about the, I don't believe in the testimonials, because testimonial these days
Testimonial can be fake
yes,
also.
it should be always should be a publications.
Yeah, data
Publication.
driven.
Yes, so because I always believe a research backed up. Are they having some publications and in any international congress where they have presented on the international diaspora or not? These all things
That's
are
a very good point. Yeah, seeing publications would be very important. You know. So how long before advanced treatments like iPSC or exosomes become affordable for everyone?
Even iPSC we don't know yet. It's very early to comment on that, because this require a very very sensitive lab, very great facility, and making the facility and management and the infra is the huge investment. And at the end, ultimately it's a business, so definitely the ROI should be there. So any innovative technology at initial level, it's a costly, but exosomes will be definitely affordable. Exosomes, and still it's not so costly these days. Even in exosomes, it's around 20,000, 25,000, or like they are selling it, most of them. But in coming future, probably it will be lesser if we are shifting more towards the more precise, personalized and the autologous therapies.
So there's a rapid fire.
Okay.
One wellness ritual that you never skip.
Doing the yoga.
Yoga. Okay, very nice. So yoga is a great thing to do.
I always do the Surya Namaskar the first thing in the morning.
Yeah, very nice.
I also would like to know about your secret.
Morning, one ritual that I always do is I drink lots of water with chia seeds.
Wow.
And I stretch, and I discovered this Chinese
Hydration
method.
is the key for the
and this
skin.
Chinese method, I'll tell you, is so interesting, so good. It takes about like 5 minutes. You do that, gym bhi jane ka zarurat nahi hai.
So
I'll show you.
this is the key of your signing.
Acha, coffee or green tea?
Green tea.
Green tea. If not stem cells, what career would you have chosen?
Fashion designing.
Fashion design. Oh, I know you're very fashionable. Dr. Prabhu is very fashionable.
That's
person.
always, if could not be in stem cells, always in the fashion.
Yeah. No, it's always designing something.
Designing something.
Or the designer wear.
Either you
cells or clothes.
Either you design the cells or the clothes.
Very nice, because he dresses up very. I've seen your the colors you use, the style you use, and
you.
and why not? Shaukin hona chahiye na, matlab.
It's a passion.
Why should we be boring? No, we should not be boring. I agree. That's why I wore this color today for you.
It's amazing.
and you are very very plain clothes. So surprised. Anyway, one myth about anti-aging that annoys you the most.
People talk about, in its word, anti is a big word to annoy.
Yeah.
I never be the anti to anyone. It's always complimenting or supplementing.
Yeah,
So
yeah.
that's why I always say, instead of anti-aging, we should use the longevity or the gerotherapeutics.
Yeah. Longevity is a better word. I agree with you. Which one did you say?
Gerotherapeutics.
Gerotherapeutics. Yeah. GERO, right?
GERO, because it came from the geriatry.
Gerotherapeutics. Yeah. Yeah. Okay. Your dream collaboration in medicine.
People like you.
Same. I think collaborations is
It's
similar,
always
similar
like-minded,
mindsets, like-minded.
research-driven people, innovative.
Yeah. We still have to do a pending research on
Yes,
GLP-1s.
GLP-1 and GLP definitely.
Yes. If listeners remember one message about regenerative medicine, what should it be?
Very difficult questions, but I always say, choose your physician very correctly.
Yeah.
especially in regenerative medicine. And before choosing any bioregime, don't be the Google doctor, be the research orientation, search the research.
Google Scholar, not
Google.
Google.
Yes.
I mean, Google, you can find everything, but Scholar would be more
Google is
specific. Yeah.
more specific.
All right. Where can people follow your work?
Definitely on the ResearchGate.
Yeah.
ResearchGate, I have publications, LinkedIn,
Hmm.
and my Instagram. I give most of the time educational video, and my YouTube. So Instagram is Prabhu Mishra 01.
Instagram is Prabhu Mishra 01, right? And YouTube, the same name?
IASRM.
IASRM is the YouTube.
Yeah, my association name is International Association of Stem Cell and Regenerative Medicine. It's a community platform for doctors and researchers. So currently we are having more than 2,000 doctors and researchers on that community.
Awesome. I can't wait to be a part of that.
It's my honor.
Okay, so before we leave, we need to ask very important question. How does regenerative medicine help menopause management?
See, that's a big question. Like menopause, especially the poor ovarian reserve, where the follicular genesis stops in early 30s. So stem cells have, this will be little technical answers for the public, but it do the immunomodulations. TH1 downregulation means all anti-inflammatory cytokines they downregulate. They act like anti-fibrotic and anti-apoptotic elements. So once we are taking the bone marrow, centrifuging, I prepare the stem cells, concentrating, and gynecologist inject into the ovary either by transvaginal or the laparoscopic. So after 6 to 8 weeks, it starts showing the down follicular stimulating hormone downs, AMH improves. Overall, the microenvironment of the ovary
Right.
improves, and cycle restores most of the times.
Okay,
In younger
that's
disease. So
fantastic.
this is what the ovarian rejuvenation, especially in the menopause or the primary ovarian insufficiency.
And do you think you can help, like, let's say somebody has a timely menopause, like let's say somebody like my age, timely menopause has happened. What can regenerative medicine add to us?
Yeah, it's like a transvaginal PRP you can give along with the bioidentical hormone, because I always believe like endocrinology is very important. Without endocrinal management, any biostimulation.
Yeah, I agree with you. Hormones have to be stabilized and balanced and
definitely
improved.
like a prerequisite of anything. There is a inclusion and exclusion.
Yeah, so I think we can work on patients for bioidentical hormone replacement before going through this kind of
it's
a
a
therapy.
prolonged treatment, but definitely the BHRT is the key for many of them, or even the HRT.
HRT. Okay, so one last thing again about fertility, like, because this is a very pressing question for most of the people, right?
Recently, we did few cases with top leaders in our country like Pansri Awadi, Dr. Manjula Angani, Dr. Hafiz Rahman, this kind of surgeons, Dr. Lavanya Kiran. So this kind of surgeons, they are using our protocols, especially the adipose-derived SPF and nanofat to prevent from recurrent adhesions and the pain in case of endometriosis. And this is going to something revolutionize the endometriosis globally.
Endometriosis is usually the biggest cause of infertility, right?
One of them,
primary
one of them.
ovarian failure.
Yeah,
is also
primary.
one.
So like even I presented this, I talked in the Cambridge forum as well. Many of the people got super impressed about this work.
Yeah. No, you're a very good, you give good lectures. I've seen and heard your lecture also. And a lot of, research based person. And that is something that I think everybody wants to have a legit person giving us a talk on regenerative medicine. Not everybody should be just coming on this platform and talking. It has to be with some backing. That's why I invited you here, because I know that you're a research and evidence-based medicine kind of guy. So that's why we were here. And now is your turn to ask me questions.
So Dr. Anjali, it's really wonderful to be here along with you and talking about on the latest advances of the regenerative medicine and the functional medicine. So you have been helping people reverse chronic conditions through metabolic and gut health work.
Yeah.
My questions to you, where do you see the biggest resistance or confusion when they hear about functional medicine or the root cause healing, and what's the main or biggest complaint they are coming to you?
Most of them, most people have definitely gut is involved. Even if gut is not involved, there will be conditions, autoimmune conditions. Hashimoto's is usually very common. Then there is PCOS is very common. We have
Thyroiditis.
thyroiditis. Then we have a lot of people who are having IgE elevations and ESR elevations and HSCRP elevation, inflammation, and we don't even know where it's coming from.
Inflammation and
Yeah,
endothelial
yeah.
dysfunction are the key.
Lots of
Yeah.
inflammation. So yeah, so most of people are coming, and obesity obviously was my mainstay of practice anyway before this. But functional medicine, because of the gut involvement and going to root cause, has helped me not cure, we'll not use the word cure, help people become better, and or either stop the progression of disease, or become
Enhance the quality of life.
and as the quality of life comes much better with
Very true. What's one underrated factor you think patients often miss in their healing journey?
I think patient miss the mental component the most.
Very true.
Yeah, I think everybody is coming to the doctor with physical ailments. Nobody talks about the mental issues, and mental issues is I find it to be a very, very important part of treatment, healing somebody mentally. And not that I can do that, but we can give tools, we can refer patients to appropriate leaders of this field where mental health can be improved. Yeah.
As you are one of the celebrity and one of the leading doctor of the functional medicine in our country, what do you think about when people come for these new drugs these days for obesity management, the tirzepatide or the semaglutide? So what's your comment on that? How much you are finding acceptability to the patients?
So 80% are accepting it. There's 20% population that says we don't want any drugs. So whether it's a GLP-1 or not, they just don't want any medications, whether it's even a metformin. So they don't want. So yeah, but there are people who don't need it, come and want it. So I think because they want to look good so desperately, people are not thinking of long term, obviously. But I definitely counsel a person of a very high BMI, like anybody over the BMI of 35.
Wow.
So I'm like, please take it, because it's to help you. Because it's a risk versus benefit ratio that I show them. Like, what are you, if you're a 160 kgs person, you're walking with another person on you all the time. Imagine the kind of stress your arteries get, your organs get. So I think it's a boon for them, but I think most people can do without it if they made up their mind. But it's not a willpower ka game also.
And it's not only for the obesity. If you'll see,
inflammation,
inflammations, fatty liver,
cardiac benefits.
Cardiac
Lilly
benefits.
just, they published a new study about
new
the cardiac
studies, so-
benefits on Manjaro. So yeah, I like these drugs, to be honest. I think they have a lot of benefit that we are not even getting at. It's coming as we go. And a lot of people come with, I'll have retinopathy and stuff like that. They're scared.
Because these all are the combined regenerative and functional medicine, and these days it's a gut microbiome is one of the
I think for
mainstay.
Indians, that is where the problem is.
Because
the gut microbiome.
especially in our culture in Delhi, we are like chole bhature to all kind of food.
No, overuse of antibiotics also, doc. You see, anybody who gets viral goes on antibiotics without even a doctor's nod. So that is one very scary part. So we in India, I think, have very bad microbiomes, and I think we should have more and more testing and more treatment therapies for that. I think that is one area that also contributes to obesity, by the way.
Thank you so much for your wonderful comments, and I'll have few rapid fire with you. So
Okay.
Name 5 foods.
5 foods that are excellent.
Excellent.
Okay.
Start the day to the closure of the day.
Okay. Start the day. I love chia seeds, I think. And then I like all kind of seeds and nuts. I myself have nuts every morning. Thanks to Gangja, I have that. And then I love, I like a lot of cucumber, beans, like vegetables, lot of vegetables. And I'm not a big fan of non-vegetarian food, but I do consume it because protein is important. So I make some adjustment to my protein levels this way or that way. And 4 ho gaya. And number 5, I think it's water.
Water is the best food.
Yeah,
It's
water is
always.
like if you don't eat any drink, if you don't eat, you're fasting, water can really keep you hydrated and nice and hungry.
Do you believe in intermittent fasting?
I love it. But it's not for everyone.
Yeah, very true.
Yeah.
Coffee, green tea, buttermilk.
Buttermilk. I'm a jart. I love buttermilk from every angle. ये coffee green tea हमने कोई पिया ही नहीं था, you understand?
So, if listeners remember one message about regenerative and functional medicine, what should it be?
I think listeners should remember that both are complementary aspects of longevity and good health. So I think you should work with people who can offer both or combine the two and maybe make a team
Very
and
true.
work as a teamwork with two doctors, like from each area can work on a single person in harmony, because doctors don't like to listen
We should
to
always
other-
believe
Yeah.
in the collaboration. Without
Yeah.
collaboration is the key of the success.
It is definitely,
key
and
of
I
the
tell you,
success.
I think we learn every day. No doctor can say, "Oh, I know everything." No, you don't know everything. There's a learning every day, and every patient teaches you. Every now Instagram is also teaching you, so there is so much to learn that there is no time you can devote to like reading.
It's so wonderful to be with you today and learning and sharing from
Yeah,
each
it
other.
was really
And
good conversation. है ना? It was
where
really
can
good.
people follow your work, doctor?
I am on Instagram, Anjali Hooda, MD.
Although it not required, you are already
Yeah,
a celebrity
I
doctor,
don't
but
need to.
just for the people, those who are new
Oh,
followers.
I have an affordable consultation, so that is also easy.
Yeah, consultation, but you are celebrity with your work, with your presence, with your society, with your network, with your influence.
Yeah, I thank God. God is kind. I have very good patient network, and it's a word of mouth happens. So I'm very very thankful to God.
Thank you. Thank you
Thank
so
you.
much.
Thank you so much.
Sure.
Okay, Dr. Mishra, thank you so much for this amazing knowledge and futuristic point of view for the healing and benefit of people in future. And I hope your dream to make it more affordable comes true. And we should, I think, research and get into this field of regenerative medicine, like all of us learning and from people like you, attending your fellowship programs and listening to you at lectures, reading your articles. I think that is something that you really brought a lot of important aspect to this podcast today.
Thank you. Thank you so much for this wonderful platform. And definitely, this is for the society and the exchanging the knowledge and the experience among us and to spread to the community. It's my pleasure to be here, Dr. Anjali, with your platform. Thank you
Thank
very
you
much.
so much.